I'm Dr. Joe Wood, and I'm a resident here at Port Angeles. And with me is Dr. Brianne Rowan. Why don't we start by having you tell us a little bit about yourself?
Thanks so much, Joe. Yeah. So I'm faculty here with the residency program, and I oversee a lot of our obstetrics curriculum. In addition to some of the other rotations, I work a lot with kind of incorporating the medical students into the residency program. And I'm one of the full spectrum faculty, so I do inpatient and clinic and high-risk obstetrics, including C-sections.
Cool. And aside from all the medical things we do, we also do some really fun things. Do you want to talk a little bit about some of the fun things we do?
Yeah, I mean, I think one of the funnest things that we do at the start of the year is we go on a rafting trip. And that trip, we get to go camping, and we all bring our families, which is really fun. The first year that I went, I brought my, she was 18 months at the time, my daughter, and she had so much fun on that trip. She brought her little life jacket. She wore it around afterwards, and afterwards at camp, we all got together and we had a great time, and she took her little paddle with her and drug it all the way around camp back and forth and just walked around and took that paddle with her, and the residents all got to interact with our whole families, and yeah, we just had a really good time, really fun family atmosphere.
It's fantastic. And here at Port Angeles, we're interesting because we're a rural community, and with that comes some special cases that I feel are very unique to our situation. Are there any special cases you wanted to discuss or share?
Yeah, there's so many. I think, one of the things when I came out here from my training that I was surprised about is it is not just bread and butter. And I remember the first time I came out here, I said to one of my colleagues, like, wow, you guys see these crazy cases out here. And sometimes we really struggle to get them transferred to other hospitals where they should be. And so they are here, and the residents join us in managing all of those cases. And I think the most interesting learning that we do side by side with the residents are really those cases where there's a rapid response or there's like a sudden clinical deterioration. I can remember a particular case on the OB unit where we had just delivered a baby, and myself and Dr. Caldwell, one of the residents, were with the patient who just suddenly was short of breath and had chest pain and felt lightheaded. And we were going in our minds through all the different possible clinical scenarios. Could she have an amniotic fluid embolus? Could she be hemorrhaging even though we didn't see a lot of blood? Could it be hidden behind the placenta? Was there something else going on? Was this related to her epidural? And watching Dr. Caldwell go through that differential and start to manage things and start to say, well, I'm going to make these decisions because these are the scariest things that might be going on, and I'm going to call anesthesia to the bedside. I'm going to order these labs, and walking through her with that process is really fun because it's critical, it's life-saving, and you are doing it side by side with the resident and watching their clinical skills develop. And that patient did great. It turned out that she had just vasovagaled, but all of those other things that we walked through and got her feeling better. It was just this beautiful scenario of thinking through kind of the complicated medicine and doing that and being there in real time with the resident. And that's something that's unique to our program because we really often work one-on-one with the residents in a way that a lot of other places don't. And so, yeah, it's just a beautiful thing. That's one of the things I really love about being out here.
And you were sharing with me some advice that you would give, say, a fourth-year medical student about that uniqueness and kind of have an idea. Can you share what that was again?
Yeah, I would say if I had to give one piece of advice to a fourth year or an applicant is to kind of begin with the end in mind. So think about where you really think you want to go and where you really think you want to practice, and then choose a program that's going to allow you to get there. And sometimes that's hard to do, and sometimes it's easier to do. I actually was one of the very first applicants to this residency program, the very first year they opened. And I told Rob Epstein, who was the program director at the time, I said, I want to come back to Port Angeles and practice. And so here I am. And it didn't work out for me to come and join that first year class for a variety of family reasons and other reasons. But I think, it would have been actually a lot easier to spend my first year had I trained here. And it turns out that this program has, I think a lot of opportunities for people who might want to practice in this area in terms of preparing you for the type of medicine that you're going to be doing. But also with so many electives and so much flexibility and so many faculty who have really been doing rural medicine. I think that our residents are really in a unique position to be able to choose the type of medicine that they want to do and the skills that they need to learn to then be able to go and do the job that they are dreaming of doing. And so having that end kind of at the forefront and knowing what skills you want to get is, I think, a really important thing for when you're applying to residency program.
Important to be thinking about, yeah. As well as uniqueness of our curriculum, there's also the uniqueness of this rural area that we have with natural beauty all around. What are some of your favorite things about Port Angeles as a community and just the area it's located in?
Oh my gosh, it's so beautiful. There's so many things I love about living here. I mean, you just have access to all of the outdoors. I would say that's like how I spend most of my free time, is taking my family either up to Lake Crescent. We love to like throw the kayak in the lake, or getting out and camping. We just took our daughter out to Salt Creek, and actually our 6-month-old as well. So there's a great campground just outside of town that has camping. There's the farmers market that is around year-round, which we call the cheesy market because there's a great bakery that has cheesy bread. So it's now, known to myself and Dr. Nelson, who's one of the other providers here. Her children also call it the cheesy market. So we go to the cheesy market a lot. It's great. I mean, there's anything you could ever want to do outdoors is available here, which is awesome.
Yeah, absolutely. And then a little icebreaker question that we thought was fun was, what would be your favorite kitchen utensil and why? If you were a kitchen utensil.
Yes, if I was a kitchen utensil, yes. I understand that this is one of our residents' favorite icebreaker questions. So I think if I had to be a kitchen utensil, I would have to be a spatula. And that is because that is probably, I think, the first kitchen utensil that my 2-year-old daughter learned how to say, probably even before fork or spoon would be my guess, because every morning she wants to make pancakes. It's the first thing she wants to do when she wakes up in the morning. And so we flip pancakes with our spatula. So spatulas bring me a lot of joy.
That's awesome.
Yeah.
What is the best thing about teaching residents?
I think that the tried and true answer that I think everyone has is that it's just, you guys keep us on our edge and keep us learning all the time. But I think that one thing that doesn't get talked about so much is that being part of a residency program keeps us thinking about what is the bigger picture of family medicine. As faculty, we're thinking about what type of training do all of the residents need in order to go out and be the type of providers that family medicine needs. And particularly as a rural program, we're thinking about what is it that rural America needs that we need to be focusing on within our program. And those types of big picture questions and answers are the types of things that I think bring us wellness and bring us joy and bring back the joy in medicine, because, I find a lot of joy in my day-to-day patient interactions, but I think there's also a lot of joy in thinking about what is it on a big picture that we are doing for the world, and what is it that family medicine is providing for our communities, and training the next generation of people to go out and do that is something that just inherently brings a sense of joy to the practice of medicine. I think that's one of the best things about having residents and being a part of a residency, is feeling kind of part of the bigger picture.